Welcome back to the Best PT Podcast. This is episode 4.3, Cardiovascular Pathologies. Let's start from the top with aneurysms. Caused by local abnormal dilation of a blood vessel. Signs and symptoms. Aortic aneurysms tend to be asymptomatic, but can include abdominal or low back pain with belly button pulsations. Cerebral aneurysms can cause severe and sudden onset of headache with a stiff neck, seizures, diplopia or double vision, loss of consciousness, nausea, and vomiting. Treatment includes surgical clipping and endovascular coiling. Antihypertensive drugs are also indicated. And angina pectoris is chest pressure or discomfort due to myocardial ischemia. 3 subtypes of angina. Stable angina occurs at a consistent level of exertion and responds very well to nitroglycerin medication and rest. Unstable angina is more intense, longer-lasting chest pain, occurs spontaneously at rest, and gets progressively worse. Prinzmetal or variable angina is due to a coronary artery spasm. Signs and symptoms include feeling of a heavy pressure or fullness or squeezing feeling behind the sternum. Can also be felt in the neck, back, jaw, shoulders, or arms. Treatment includes supplemental oxygen, nitroglycerin medication, and rest. Atherosclerosis is caused by fatty plaque buildup in the arterial walls that can eventually cause a clot. Signs and symptoms include angina due to myocardial atherosclerosis, numbness or weakness of the legs due to cerebral artery atherosclerosis, or intermittent claudication, peripheral atherosclerosis. Treatment includes lifestyle change, medication, and possibly surgery. Cardiomyopathies are caused by the impaired myocardial ability to contract and relax due to dilated cardiomyopathy, hypertrophic cardiomyopathy, or restrictive cardiomyopathy. Signs and symptoms include breathlessness with exertion or at rest, lower extremity swelling, and abdominal bloating. Treatment depends on the type of myopathy. For dilated cardiomyopathies, ACE inhibitors, beta blockers, digoxin, diuretics, external cardioverter defibrillators or life jackets, implanted cardioverter defibrillators or biventricular pacemakers. For hypertrophic cardiomyopathies, low pressor and calcium channel blockers. And for restrictive cardiomyopathies, diuretics, antihypertensives, and antiarrhythmic medication. Chronic venous insufficiency is caused by veins or valves in the lower extremities that are damaged and can no longer properly pump blood back to the heart. Signs and symptoms include leg swelling, varicose veins, aching, cramping, itching, redness, or pain in the lower extremities, and skin ulcers. The main form of treatment is compression stockings. Congenital heart defects are the most common type of birth defect. There are a couple. We have atrial septal defect, or ASD, is due to a hole in the wall of the heart separating the atria. Signs and symptoms include heart murmur, shortness of breath, fatigue, stroke, and cyanosis. A small ASD can be asymptomatic. Treatment is a surgical closure for larger defects. Aortic coarctation is when the aorta is narrowed near the ductus arteriosus. Signs and symptoms include pallor, sweating, shortness of breath, and high blood pressure. Treatment is surgical repair or balloon angioplasty. Patent ductus arteriosus, or PDA, is due to the ductus arteriosus not closing after birth. Blood continues to shunt from the pulmonary artery directly to the aorta, so deoxygenated blood is being sent right back out into systemic circulation. Signs and symptoms include tachycardia, respiratory distress, and congestive heart failure. Treatment includes surgical repair and diuretic medication. Ventricular septal defect, VSD, is a hole in the ventricular septum, resulting in too much blood pumping to the lungs. Signs and symptoms include cyanosis, heart failure, swelling, and a general failure to thrive. Treatment includes surgical patching or stitching. Tetralogy of Fallot. The cause is a combination of ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, or right heart failure, and overriding aorta. Signs and symptoms include cyanosis, shortness of breath, finger and toe clubbing, fainting, heart murmur, and general fatigue. Treatment includes surgery to patch the VSD and then widen the pulmonary valve and arteries. Cor pulmonale, or pulmonary heart disease, or right heart failure, is caused by right ventricular hypertrophy. Signs and symptoms include progressive shortness of breath with exertion, lower extremity swelling, atypical chest pain, and dizziness. Treatment includes supplemental oxygen to maintain SpO2 above 90%, diuretics, and anticoagulation therapy. Coronary artery disease is caused by a narrowing or blocking of coronary arteries due to damage of the inner wall of an artery. Fatty plaques will accumulate in the injury, as do platelet plugs, which causes arterial occlusion. Signs and symptoms include angina, shortness of breath, and possibly a heart attack. Treatment includes lifestyle change, antiplatelet medication, ACE inhibitors, statins, angioplasty, and a coronary artery bypass graft, or CABG. Deep vein thrombosis, or DVT, is caused by a blood clot in the deep vein, usually in the lower extremities. Signs and symptoms: half of all people with a DVT are asymptomatic. Those with symptoms may include swelling, pain, and redness of the lower extremity. Treatment includes anticoagulant therapy and possibly an inferior vena cava filter to prevent the clot from getting to the heart. Remember that there is no activity allowed for a person with a suspected DVT until they've had anticoagulants for at least 24 hours. If the clot becomes dislodged, it can become a pulmonary embolism. Endocarditis is an inflammation of the endocardium, which is that tissue that lines the heart and cardiac valves. Signs and symptoms include fever, chills, and a heart murmur. Treatment involves antibiotics, and surgery may be indicated. Congestive heart failure is when the heart cannot maintain normal cardiac output. The ventricles weaken and dilate. Blood begins to back up into the liver, abdomen, lower extremities, and lungs. Signs and symptoms include an irregular heartbeat with the ability to detect S3 and S4 heart sounds, persistent cough or wheezing, and weight gain due to fluid retention. Treatment includes medication, lifestyle change, and assistive devices. Heart murmur is caused by turbulent blood flow through a damaged or narrowed valve. It can be benign, such as with exercise, pregnancy, or fever. Signs and symptoms include cyanosis, edema, shortness of breath, weight gain, chest pain, dizziness, and fainting. Treatment includes digoxin medication, anticoagulants, diuretics, and antihypertensive agents. Hypertension is caused by sustained elevation of systolic pressure at 140 millimeters of mercury or more, or sustained elevation of diastolic pressure at 90 millimeters of mercury or more. Signs and symptoms include the development of an S4 heart sound as an early warning sign, confusion, cortical blindness, angina, dyspnea, and kidney damage. Treatment includes lifestyle modification, diuretics, beta blockers, calcium channel blockers, ACE inhibitors, and vasodilators. Lymphedema is due to the accumulation of lymph fluid in the extremities due to damage or obstruction of lymph vessels. Signs and symptoms include limb swelling, impaired range of motion, and aching, non-pitting edema. Treatment includes pressure gradient bandages, lymphatic massage, pneumatic compression, and compression garments. Myocardial infarction is due to blood flow through one or more coronary arteries that become severely occluded or totally blocked, causing irreversible myocardial necrosis. Signs and symptoms include angina, shortness of breath, pain in the arms, shoulders, neck, or back, nausea, vomiting, dizziness, sweating, and heart palpitations. Treatment includes lifestyle modification, cardiac rehabilitation, anticoagulants, antihypertensives, statins, and a coronary artery bypass graft, or CABG. Myocarditis is inflammation and weakness of the myocardium due to bacterial or viral infection. Signs and symptoms include arrhythmias, angina, shortness of breath, fatigue, and fever. Treatment: antibiotics, diuretics, beta blockers, calcium channel blockers, and possibly surgery to implant an intra-aortic balloon pump or ventricular assistive device. Pericarditis is inflammation of the pericardial sac due to virus, bacteria, or fungus. Signs and symptoms include angina, shortness of breath, a dry cough, fatigue, fever, and something called cardiac tamponade, which occurs when pericardial fluid creates pressure on the heart that prevents it from filling with blood, which can be fatal. So the heart is trying to pump and expand against this fluid that is basically squishing it and not allowing it to expand properly. Treatment includes medication and possibly a pericardiocentesis to remove the excess fluid. Peripheral artery disease is due to stenosis, occlusion, or aneurysm of the aorta and peripheral arteries. Signs and symptoms include pain in the buttock, thigh, calf, or foot at rest or when walking, poorly healing wounds, distal hair loss, and hypertrophy of the nails. Treatment includes lifestyle change, medications, surgical revascularization. Exercise is recommended 3 times a week, 30 to 45 minutes for 12 weeks to reduce peripheral artery disease. Rheumatic fever is caused by untreated or poorly treated strep throat that causes heart damage to the heart valves. Signs and symptoms include painful joints, heart palpitations, fever, and a skin rash. Treatment here is antibiotics. And finally, valvular heart disease is due to damage to a heart valve causing regurgitation or leaking of blood backwards through a damaged valve. Signs and symptoms include heart palpitation, shortness of breath, angina, coughing, ankle edema, and fatigue. Treatment includes medications or possibly a balloon valvuloplasty or surgical repair in very severe cases. That's it for episode 4.3, talking about cardiovascular pathology. The next episode, 4.4, will talk about pulmonary pathology. As always, the outline will be in the show notes. Thanks for joining.